Stop doing these three things if you have pubic bone pain. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. If you're experiencing pubic pain down here low, like over the bone, I want to give you three simple tips in your everyday life that can help you improve your pain. So what I'm talking about is pain here, right at the bony part of the pelvis, right here, real low. And you might experience this if you are currently pregnant, if you have had a baby where we have some changes in the body, or maybe you've had a fall or you've had an injury and you're experiencing this type of pain. So let's get started. Number one, stop clenching. Stop clenching your butt, stop clenching your inner thighs, just stop clenching. All of the muscles of your pelvic floor attach onto the backside of the pubic bone, and they come back and attach onto the bottom of your sacrum, or like your low back, kind of between your butt cheeks. So if you are clenching, you are making your pelvic floor muscles and these butt muscles, you're getting them to have tension in them all of the time. And that can really impact what is going on here at your pelvis and particularly at that pubic bone. So stop clenching. Number two, stop sitting with your legs crossed. Uncross your legs and open them up. When you cross your legs, it creates a lot of tension and strain here in the front side. So stop crossing your legs. Number three, stop doing one-legged exercise or movements. What I mean by that is stop doing lunges where you are uneven to the front, to the side, to the back, those split squats where you have your leg to the back. Also, think about what you're doing when you're standing. Make sure that you're not just shifting your weight to one side and primarily putting it to most of your weight on one leg. So that might be holding a baby, standing in line, cooking. So look for opportunities to limit and stop doing those one-legged movements. So those are some really easy, quick tips that you can get started with right now to make a difference in your pubic bone pain. However, it's not really a great long-term solution, because I bet at some point you're going to want to move a little bit more freely and without worrying about causing pain. So let's talk about what can you do instead. Before we head to some longer term solutions for your pain, I want to take just a moment to explain why you might be having pain at your pubic bone. Here I'm looking at the pelvis, and you can see as it goes around here. Basically, if you were to put your hand on your hip, landing here at the top, you would land right here on the top of the pelvis. So you could see here we have the right side as it comes forward and this left side. Okay, those two sides of the pelvis, those bones, they meet up and they create the pubic bone. Okay, most people think they have one pubic bone. It's actually, you have two halves, and that's what makes up this pubic bone, right? And then from the back side, you can see how the pelvis comes and attaches onto the sacrum, or the very end of your back. So what I see oftentimes as a physical therapist is there's a lot of changes during pregnancy. Of course, we have growing baby, we get these lengthened out of the muscles that attach into this area, and we get a lot of pressure and changes in our posture and alignment that puts a lot of pressure here. But this also can continue and linger into postpartum. So I see all kinds of people, all kinds of moms that have pain at the pubic bone during pregnancy, and then it stops after they have baby. But I also see women that didn't have any pain during pregnancy, and they have pubic bone pain that lingers after they've had their baby. And then I also see people in both categories, meaning they have pain during pregnancy and it never goes away. So what I explain to them is there can be an imbalance here where these bones are not necessarily lined up and level. And what I see most often is that the right side is high and rolled forward. We call that an upslip and an anterior rotation. So you can see as I do that, it starts to create some strain into this area here. And that doesn't necessarily just go away on its own after babies. Now, You might be thinking, but I've never had a baby. I still have pubic bone pain. Well, if you've ever had a fall down onto your bottom or down onto your hip or the side, you still might have some imbalance here. I see this a lot from sports injuries, from even car accidents, from falls, from snowboarding. I mean, you name it, there can be a lot of imbalance here. Can also be from sports themselves. I don't want to get into all of it, but a lot of clinching can happen from gymnastics or dancing, or even like horseback riding. It can be just a lot of things going on here into this pelvic area that can lead to some imbalance. And that's just looking at the pelvis. That's not even looking at anything around the abdomen or lower back or anything that can contribute to this. So just wanted to give you a little bit of an idea of why this might be happening, and why when we go into the longer term solutions, that those might be helpful. But really, having somebody assess this for you is a really good option, so that you know exactly what's going on with your body and what needs to happen to get you feeling pain free again. Okay, so first off, with the clenching, it's pretty obvious, right? Like that one is more like just stop doing it. But how do you do that? It's probably a habit. It's probably just something that you do and you're not even aware of it. So to get on the other side of that, it's basically trying to bring more awareness to your body, checking in with your body, and being intentional about that. I notice as a physical therapist when I'm working with my patients, I often do this where I'm clenching my bottom and I'm just checking back in with my body periodically and reminding myself that there's no reason for me to be so um, like overworking and clenching. And I just remind myself to relax and breathe into those areas. So it takes at first a lot of mindfulness to remember to do that. You could do something like, say, sitting and breathing down into your hips and into your lower back and pelvic area, maybe practicing some meditation. What I find with a lot of people is that with the clenching, there's usually a bracing or a holding pattern that they've developed over time. And that can be from previous injuries or traumas or things that have happened in their life. And so, again, just bringing some attention to that. And whenever you notice that you're clenching, just remind yourself that you're safe and it's all right to let those muscles go. They don't need to be overworking. As far as sitting with your legs crossed, again, that can be a habit, right? That you just always, you sit, and usually what I find is people have a tendency to always cross the same leg over the other. I have been asked, well, is it okay if I just, spend equal time crossing one leg and then remember to cross the other? I think that's a okay solution. I think that's better than always crossing one over the other. However, the best solution really is to sit with your legs uncrossed. And I know you, if you're a lady, you might have been told when you were growing up, like sit like a lady, cross those legs, keep things closed. But it really is better if you try to have more of an evenness in your legs when you're sitting. So sitting at least like this, or even maybe into a V position. So just don't listen to your mom on this one. And just try to break that habit of crossing your legs. So when it comes to exercise or movements where you find yourself standing on one leg or shifting, what I would suggest is exercise by keeping your weight evenly through both legs. So doing things like squats, deadlifts, there's a lot of things that you can do to still work your legs without having such an imbalance there. Okay. The other thing is, again, it's more of a habit. Like if you do catch yourself shifting your weight and standing on one leg, is bringing awareness back to your body and reminding yourself that it's best to put that weight evenly down through the center of your body and have the weight distributed right and left foot evenly. As far as standing and putting your pants on, go ahead and sit down. That's going to help you while you're healing with this. May not be necessarily a long-term solution, but if you put the rest of this information into play, I bet you're going to start to notice some improvements in your pain. And then eventually you'll be able to go back to doing some of those activities that you really enjoy. And my last tip is for more longer lasting pain relief is seek help from a pelvic floor physical therapist. We really are trained in assessing your movements and finding out why the pain is happening, and you really get into the root cause of what's going on and really assess what you're doing, what your body really needs in order to get rid of the pain for good and have that long-term solution. We would love to give you a little advice and help you here at the Healing Spot. You can head to our website, healingspotpt.com, and pick whatever option works out the best for you. Let's get you in for a discovery session or have a phone call so that we can get all of your questions answered and help you start to be more active and feel good again in your body. Thanks for watching this Ed Talk. I'll see you on the next one.